And welcome everyone, and good afternoon, good morning, and good evening, wherever you are living. And thank you for joining us for the seminar today. And it is grateful to have Dr. Salomé Aubert as a guest speaker today. Salomé grew up in New Caledonia, one of the beautiful islands in South Pacific, and moved to Rennes in France, where she completed her bachelor's and master's degrees in health and physical activity sciences. And Salomé just completed her PhD in population health at the University of Ottawa under the supervision of Dr. Marc Tremblay. And her research focused on the international promotion of the active, healthy lifestyles among children and youth. So she is also a member of the board of directors of the Active Healthy Kids Global Alliance. She is not only a great researcher, but also she's an artist and outdoor enthusiast on her free time. And I like to acknowledge that she is one of the many who graduated with her PhD during this pandemic. So huge congratulations, Salomé. And now I will pass you over to Salomé. The floor is yours.
Thanks a lot for your introduction, Erica, and thank you, Bridget. So I'm gonna share my screen. You let me know if it worked. Does it work?
Yeah, if you can put the full screen on, that would be great.
Okay. Can you see?
Perfect. Yes.
Yes. Okay, so thanks a lot for the introduction, and thank you everyone for attending my presentation on the global prevalence of physical activity for children and adolescents, inconsistencies, research gap, and recommendation. Please, Erica, do not hesitate to interrupt me to let me know if you can't hear me well.
Okay, I will.
Thank you. So for the introduction, benefits of physical activity for the health and well-being of people of all age are not now widely recognized in the scientific community, and there's positive effects are seen in a multitude of health markers such as blood pressure, lipid profile, glucose control, cardiometabolic diseases, inflammatory markers, and cognition. So in order to improve fitness and health, the World Health Organization has developed physical activity recommendation specific for the early years, stating that they should accumulate at least 180 minutes a day of total physical activity. And for the 5 to 17 years old children and adolescents, stating that they should engage in at least 60 minutes a day of moderate to vigorous physical activity. And physical inactivity, which is defined as an insufficient physical activity level to meet present physical activity recommendation. And children, according to numerous systematic reviews, children and youth physical inactivity is associated with adverse physical, mental, social, and cognitive health outcome, lower physical fitness, and lower physical activity level in later life. So in 2018, the World Health Organization has released a global plan on physical activity with a goal to reduce the global prevalence of physical inactivity by 15% among adults and adolescents. And one of the strategic actions that was identified by the World Health Organization is to enhance data system and capabilities at national levels to support regular population surveillance of physical activity. So the aim of our project are to review, compare, and discuss methodological inconsistencies and difference in physical activity prevalence estimates from the available international physical activity surveillance initiative, and to identify methodological limitations, surveillance and research gap, and propose recommendations for improvement. So for the method, we decided that doing a narrative review would be an appropriate format to try to tell like these stories. So we several intercontinental physical activity surveillance initiatives were identified by experts and by non-systematic literature search. And they had to meet the following criteria, they should present data that was collected or that were collected or compiled during or after 2000. Include at least multiple countries from at least 2 continents, focused on the early years of children and adolescents. And early years children and adolescents of all ability, need level, and health status could be included. They had to present physical activity prevalence that were assessed or estimated using self-proxy report or device measurement. And we only included the most recent data set of the identified initiative. We also proceed at doing extraction. So once we identified this initiative, we proceed to do extraction of national physical activity prevalence that were available by country and when possible by sex. We had an exception with a Goethals and al. Publication that was included in this project, where 2016 physical inactivity estimates were extracted and then converted into prevalence of physical activity. And we also calculated physical activity prevalence regional average using a simple average calculation with, again, an exception for the paper from Goethals and al. That was published in 2019, where the available physical activity pooled regional average were directly extracted. We also extracted specific information related to the method for each included physical activity surveillance initiative, such as sample size, age and grade of participants, years of data collection. For the questionnaire-based initiative, definition for adherence to physical activity guidelines, specific items assessing physical activity, information concerning the language available for this questionnaire and their validity, and the method used for the translation and cultural adaptation were also extracted. And for the device-based initiative, definition for adherence to physical activity, type of device, minimum wear time, and cutoff point were also extracted. We are also planning to do a quality assessment of the included initiative, and we did not find a good already existing available tool for doing that. So we are considering using a whole list of criteria to do the quality of assessment of the included initiative. And this might not be the final version yet of it, but I provided the list of criteria we included, such as adequate description of the sampling frame and recruitment method, adequate description of the sample key characteristic, adequate description of method of data collection, adequate harmonization and validity of cross-country comparison, appropriate sex-specific analysis, etc. And finally, we also did some simple comparison of the method and result across the included physical activity surveillance initiative, and try to map physical activity prevalence difference against method and validity translation difference. So for the result, we identified 8 intercontinental physical activity surveillance initiatives that were meeting the selection criteria. And I am describing them more in this table 1. So I will try to describe each of them briefly, so you know what I'm talking about later when I will be mentioning the name. So we have the Global Matrix on Physical Activity for Children and Youth 3.0. So the Global Matrix is an initiative that is led by the Active Healthy Kids Global Alliance, bringing together a working group from countries across the world who follow harmonized procedure to develop their report card on physical activity for children and youth by compiling the best available data in their country to grade common physical activity indicators. This initiative occurred every 2 years since 2014, and its target population are the 5 to 17 years old children and youth, children and adolescents. And in the most recent cycle, 49 countries from 6 continents were included in this initiative. We also have the official, we also identified the official international report of the 2017-2018 HBSC survey. So HBSC means health behavior in school-age children. The HBSC is a school-based survey where standardized self-report questionnaires are administered to a nationally representative sample of 11 to 15 years old adolescents within the classroom setting. This survey occurred every 4 years since 1982. So its target population are the 11, 13, and 15 years old adolescents. And in the most recent cycle, 48 countries and regions across Europe and North America were included. We also identified the ICAD study. So ICAD means International Children's Accelerometry Database. And so the ICAD was established to pull data on device measured physical activity from studies using the same type of accelerometers, actigraph, one at the waist. So investigators from 20 countries with a sample size greater than 400 participants, they agreed to share raw accelerometry file, and standardized reduction and data analysis were performed to create comparable physical activity prevalence. The data from cross-sectional and longitudinal studies that were collected between 1988 and 2009 were pooled and reduced and harmonized between 2008 and 2010. And the target population are the 3 to 18 years old children and adolescents. And so far they have pooled data from 10 countries, but they are planning to expand more in the future. We also identified the ISCOLE study, which means International Study of Childhood Obesity, Lifestyle, and the Environment. So the ISCOLE study aimed to determine the relationship between lifestyle behavior and obesity, and to study the influence of additional characteristics, such as behavioral settings, physical, social, policy environment, on the observed relationship. It's a cross-sectional study where data were collected in each study site between 2011 and 2013, with the exception of Mozambique, where data were collected in 2018. And target population is the 9 to 11 years old children. So far a total of 13 countries from 5 major geographic regions of the world were included. We also identified that publication from Marcus et al. Published in 2020. And the aim of this paper was to present worldwide, national, and regional prevalence of physical activity participation according to its frequency in adolescent age 11 to 17 years. So this study used the cross-sectional survey data from multiple different surveys, including the HBSC I have already presented, the Global School Health Survey, the Youth Risk Behavior Survey, the PENSE, which I forgot what it stands for, and the NSANUT, another one. Well, so a variety of major international physical activity survey. And so it included a total of 105 countries across 8 regions. And so its target population is 11 to 17 years old adolescents. We also identified the Gotthold et al. Publication. So this author compiled surveys that collected physical activity data among adolescents across the world, and they performed complex analysis to obtain an estimation of the prevalence of physical activity by sex and by country in 2001 and 2016. It included 194 member states, so 146 countries, and their target population was 11 to 17 years old adolescents. And the first round of this paper was performed in 2018, and they're planning to do the same thing in the next 15 years. And so we also identified the the official national report from the Global School Health Survey, GSHS. And so the GSHS is a school-based survey using a self-administered questionnaire to evaluate young people's health behavior and protective factor related to leading cause of morbidity and mortality among children and adults worldwide. Its target population is 13 to 18 years old students. And there is no established frequency. The participating countries are encouraged to collect data as often as resources allow them to do it. And so we found an official report for 87 countries from 6 continents. Finally, we also identified this publication from Xu and al. That was published in 2020. And the aim of this study was to describe and compare the separate and combined prevalences of physical activity, active transportation, physical education, and sedentary behavior among adolescents aged 12 to 15 years old in low and middle income. And they also use the GSHS data. So they included 54 low to medium income countries from 5 regions. So this table presents the extracted physical activity prevalence for a sample of 13 countries across the 8 initiatives I just presented. But to give you an idea, we have a full table like that for something like 190 countries or state members. And sorry. Yes, and so for example, if you look at the line for Brazil, you can see that we observe like a great variability in terms of physical activity, estimated physical activity prevalence of children and adolescents. So, for example, in the Gotthold et al. Publication, the 2016 estimated prevalence of physical activity for the 11-13 years old was 16.4%, while the global metrics estimated this prevalence to be to range between 27 and 33%. The ISCOLE study to estimated the prevalence of 43.9%. The ICAD for the prevalence was for ICAD study was 7 for the boys and 2 for the girls. And Marcus et al. Using the GSHS data estimated prevalence of physical activity among children among 11 to 17 years old at 12%. Similarly, if you look at the USA, you can also see that with a 28% prevalence in this sample that I'm presenting here, like USA is the country with the highest prevalence. But if you look at the global matrix prevalences, the USA is among the lowest in that sample. And same thing with ISCOLE and ICAD, the US prevalence is also generally lower than the other observed prevalence. And Marcus et al. Paper estimated that is again the highest, but it makes sense because the Gotthold et al. Paper and the Marcus et al. Paper use the same data set for calculating the estimation. And similarly, if you look at Slovenia, you can see the same thing, a great variability in the estimated prevalence of physical activity for children or adolescents. And you can see like this was a big, very big difference is observed. Like we observe only 20% of children of adolescents meeting the physical activity guidelines in the Gotthold et al. Paper, while for the global matrix, 20 to 26% of the children were estimated to meet the guidelines in Slovenia. And again, the way lower prevalence of physical activity was estimated for in HBSC and Marcus and al. So it's important to highlight, I will develop that a little bit in the next slide, but just I want to highlight that the methods are very different across this paper. And for example, in the global matrix, like this estimate was calculated using a national survey that was using both questionnaire and accelerometry, while like the Goodhold and all and the Marcus and all estimation were using the GSHS data. So in this table, I presented the methods of the international initiative that were included, that it's briefly described. And also just to give you an idea, so the global matrix on physical activity for children and youth, participant countries are not collecting data, but they're gathering the best, they have to gather the best available data from local, national, and international study. And they have to make choice, and they're like, they have to use their own expertise to estimate which data is the best quality and has more chance to, their estimate is the best to estimate the national physical activity prevalence. So sometimes they decide that the national survey has a better quality and will provide a better estimate than the data from an international survey such as HBSC or GSHS. For the HBSC, they used a standardized questionnaire with 2 mandatory items to measure physical activity. Accelerometry was used for the ICAD study and for the ISCOLE study. And then Marcus et al., Goodhold et al., Xue et al. Publication. They compile several available data that were already collected, and most of them were like the GSHS survey and the HBSC survey. And this is the official report as well from the GSHS survey. For the GSHS reported in official, sorry, the official WHO fact sheet used the GSHS data as well. That was collected using as well standardized questionnaire. So as discussion point, I did not highlight it, but we also extracted the different physical activity definition that were used for each of these physical activity initiatives. And so we observed inconsistencies in terms of physical activity definition. Most studies and initiatives used more than 60 minutes a day of moderate to vigorous physical activity, but lots of other definitions were used. For example, 60 minutes a day of physical activity on 5 or more days a week. So the data collection and analysis method varied significantly between initiatives, and the estimated physical activity prevalence of children and adolescents for the same countries varies a lot across the included initiative. And what is the biggest problem, in my opinion, with what we observe is that the cross-country comparison differs across initiatives. So what I mean by this is that the countries with the highest and the lowest prevalence of physical activity are not the same. The countries are not classified the same, but from the most active to the least active, depending on the initiative. We also identified several surveillance gaps. So there is almost no data, no international data on the early years, and children below 10 are underrepresented in comparison to adolescents. There is also almost no data available for children and youth with special needs. So we did not include it, but the HBSC survey include in their sample like children with special needs, but they haven't published a specific international report presenting the physical activity prevalence for that specific population. And we also identified like a few other things, like the global matrix now. So a few countries are starting to develop report cards that are specifically targeting children and youth with special needs. There are also less data available in low-income countries, and generally the available data is of lower quality. And by this, I mean smaller sample size, and the data are generally older. And the majority of the available international data was collected using self-report questionnaire. But we can see that there is a beginning of international initiatives that are using device-based measurement. So for this project, has like several strengths and limitations. For the main one might be that it's we did not use a systematic review approach, but we did this because we wanted to, as we have like we are focusing on surveillance, we wanted to focus on open access and public data, and we also wanted to limit the overrepresentation of international European study versus the rest of the world, because there are like many international studies and surveys that present physical activity prevalence per country in Europe, and so we did not include them if they were only European, because else it would have put a too great focus on European and not on the global scale. And one of the strengths, I think, of this project is that we have an international panel of experts amongst the co-authors that were involved in the several included initiatives. So at HBAC, we have someone from HBSPC, we have several people from the Global Matrix, including myself. We have someone from the ICAD, the ISCOLI, and other relevant initiatives with data that are not yet available, such as the IPEN study. That is also that will also like an initiative that will have soon available international data, international accelerometry data, and the Sunrise study that is that will be also be that is still in the collection phase, I believe, and is collecting data for the on the physical activity of the early years. So our next step before publication is to perform the quality assessment of the included initiative, to develop the discussion, and to formulate specific recommendations for the improvement of future international physical activity surveillance system. But what we can already conclude with the work we have done here is that insufficient physical activity level observed across all continents and surveillance initiative. Well, there is an efficient physical activity level observed across all continents, and we also observed consistent gender and age difference, like girls are less active than boys, and older kids are less active than younger kids. So this confirms, this is consistent with the rest of the literature. There is a global physical inactivity crisis that is observed, showing that there is an urgent need for efficient physical activity promotion policies and action. And well, our main conclusion is that there is a big need for the development of a new harmonized and globally adaptable physical activity surveillance system. And so doing this is an essential step to identify priority action for the battle against childhood physical inactivity. And it would be essential that that there is a coordination of the relevant international institution and experts to address the identified inconsistencies that I presented and their surveillance gap. Voilà, thank you a lot for your attention.